Hi, I'm Dr. David Greene with PreferredPainCenter.com, where we bring you anything and everything education for pain management. Today I'm out at Cave Creek, which is an area just north of Phoenix, and there's a lot of areas that are not built on yet, such as this, that are absolutely gorgeous. And the only unfortunate thing is I'm concerned about wild coyotes coming by and biting off my arm. I haven't seen any yet, so I think I'm okay. The topic today is what to expect with an epidural steroid injection. Epidural steroid injections are one of the most common pain management procedures performed in this country, and they're also one of the oldest. They've been done for over 60 years, and they've gotten better as far as there's more types of epidural steroid injections that are being done, but it's largely unchanged, okay? Except most pain doctors will use the real-time form of X-ray called fluoroscopy to make it much more accurate. So if you have sciatica, which is pain shooting down one of your legs from a disc herniation pushing on a nerve root, or if you have spinal stenosis, which is where arthritis can cause nerve roots to also get pinched, then an epidural steroid injection is what is called the gold standard in America, meaning that it's the procedure against which all others are compared for efficacy. We know that epidural steroid injections are usually 75 to 80% effective. So they do work well, and that's been looked at in multiple studies. Some showed higher efficacy, some showed lower. There was one recently in professional athletes that showed over an 85% good to excellent results, and a lot of those were able to avoid surgery and get back to playing professional football. So it is the gold standard. Now, what to expect with an epidural? Is it going to cure the problem? Is it going to get rid of my pain? Is it a same day kind of a thing? How in depth is it? Well, here's the way that it usually works, okay? Typically you go in to see a pain management doctor. They look at your MRI, x-rays, do a physical examination, and things like that, and the problem is diagnosed. Okay? If you have a disc herniation, usually they'll be able to see where the disc is pushing on the nerve root, and they'll correlate that with your physical examination. So they'll have an idea of precisely where to put the steroid to get the effect that's needed. All right? Now, people say that an epidural steroid injection is not for back pain, it's for leg pain. It is and it isn't. It's great for leg pain, but it can also be useful for back pain. Why is that? Well, pretend this is a disc. This is the outer part of the disc, okay? If you have a tear in the outer part of the disc, it can spark up some inflammation, and the nerve root that's passing by, let's say right here, can get inflamed just from having that tear. No disc came out, it can just be inflamed. In that kind of a situation, an epidural injection for back pain can actually be very effective, okay? So it also can be a back pain injection. Well, these injections are done as an outpatient. You could have intravenous sedation if you have anxiety issues or if you've done well with it before, okay? Sometimes people just take a Valium by mouth 30 minutes before. Regardless, what the pain doctor will do is they'll numb up the skin and they'll numb the soft tissue tract down to the area where they're going to put the steroid. Most pain management doctors in the modern world use either ultrasound or fluoroscopy so they can get an accurate placement of the needle. Studies were done years ago that showed that if you didn't use one of those types of assistants, then about 30 to 40% of the needles were misplaced. So now it's more the standard, okay? So you go into the surgery center, procedure center, wherever you're going to have the injection, and you get all checked in. The procedure itself takes between 10 and 30 minutes, depending on one, how difficult it is to reach the spot, and two, how many levels you're having done. Some people have multiple levels of a problem. Like if it's spinal stenosis, you might have that. All right, so 10 to 30 minutes. And then once you're done, you go to the recovery area and they watch your vital signs for half an hour or so. If you've had IV sedation, they may keep you an hour, okay? Now, the doctor's going to tell you how long before the procedure not to eat or drink anything, all right? They're also going to talk to you if you're on blood thinners, such as ibuprofen or Coumadin. or things like that, make sure to talk to the doctor about it, because they will tell you specifically when to stop that medication. Okay? There are some risks of an epidural injection that are small but real. And anytime you're having an injection procedure, there's a potential risk of infection, which is much less than 1%. Okay? There's a risk of an allergic reaction to any of the medications that are either injected or swallowed or put through your IV. Okay? There's also a risk of some bleeding. If you're on a blood thinner, that's why you stop it whenever your doctor tells you to. All right? There's also a risk of the needle hitting one of the nerve roots. It's very uncommon, but it can happen. And if it does happen, usually it's just a transient symptoms. All right? The other one you may have is some numbness down the leg from the injection. Usually that just resolves. Okay? There's also some risks of a temporary spike in your blood sugar, which usually resolves over a few hours to a couple of days. But your doctor can go through these risks with you as well. But by and large, the procedure is at least 75 to 80% effective. All right, the risks are low, and it can be the reason that you're able to avoid surgery. So there you have it, the main reasons what to expect from an epidural injection. If you have pain down one or both legs, say from a disc herniation or from spinal stenosis, Arizona Pain Specialists can help you. They have multiple locations around the valley. They have award-winning and board-certified pain doctors and chiropractors. So they have a comprehensive treatment at each location. Okay? Now they also have spinal decompression therapy and acupuncture. They take most major medical insurances along with Medicare, some of the access plans, workers' compensation, personal injury liens, and self-pay. And there's one number to call for scheduling, and that's 602-507-6550. I'm Dr. David Greene, preferredpaincenter.com. Your pain stops here.